Lots of people ask this question, doctor, I'm having seizures and I'm taking all my seizure medications, but the seizures are still happening. What can I do to solve this problem? Well, this is a very common problem, unfortunately. We know that people with epilepsy, when treat them, we anticipate like response in about 50 to 70% of the time, they can have good response. And then there is about a third of the people, about like 25, 30%, they will have no improvement and the seizures will continue to happen despite being on maximum dose of anti-seizure medications. And this type of epilepsy is called drug-resistant epilepsy. The drug-resistant epilepsy, it happens when you have seizures despite being on two medications, either individually or combined, that are appropriately chosen, means like you have the right medicine for the right seizure type, and appropriately given, that means like you have enough time, and that failed to have sustained seizure freedom. So this is called drug-resistant epilepsy. And drug-resistant epilepsy, the statistics are like sobering, because if we have the first medication chances about 50 to 70%. And then if that fails to control the seizure, then the chances of controlling seizures will be just about 15%. And then if that fails any other medication, the chance of controlling seizures will drop to about like 5% or even less. That's like a serious, it means like any medication you add, like will not really help the seizures. So what we do in this situation is we think about first, to have to confirm that this is epilepsy by seeing the epilepsy specialized doctor, seeing the epilepsy center. We do video monitoring and EEG, it's called epilepsy monitoring unit, to first confirm that this is epilepsy. The second is that we do some surgical treatment. So if we know where the seizures are coming from, then we can, like if there is one spot in the brain and it's safe to take them out, we can take them surgically out, and that can cure the seizures. And the chances are very good very, very good if you have one spot in the brain. And if you have multiple spots, or we cannot exactly know where the seizures are coming from, then we can do devices. We have multiple devices like responsive neurostimulation, vagus nerve stimulation, and deep brain stimulation. All of those can be chances of improving the seizures and helping with that. And for all the details of which device and which surgery will be more successful, and I show all the devices and in detail analysis of all of those surgeries so that you can discuss with your doctor very well. In this video, you can see all of those details, and stay healthy, and see you in the next one. Salam.